time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hi, and hello, pet lovers. It's really great to be here again to talk to you about issues as they relate to owning pets and having pets and things that might be happening in the pet world around the community. In addition to Elanco, makers of Trifexis and Comfortis, which are the next generations of flea control, we have other sponsors as well. Trifexis and Comfortis are recommended that you give them year-round because the American Heartworm Society, the Companion Animal Parasite Council, and the Center for Disease Control in Atlanta all recommend year-round flea control, heartworm control, and internal parasite control. So Trifexis can do all of that. Esplin Medical is a company that produces a sustainable, environmentally friendly bamboo cotton scrub, and it's like wearing pajamas. We highly recommend that you buy these if you're in the health professions, and if you just want to bang around in the house, they are so comfortable you will not be sorry. So you can go to www.esplinmedical.com, and there's opportunities to order in 4 colors: navy blue, seal blue, Caribbean blue, and jade green, and in a variety of unisex tops and bottoms, women's 4-pocket tops, and some women's contrasting tops. Nice products, great product. Additionally, we picked up a new sponsor for a portion of the show at least, and that's Hills, the makers of Science Diet and Prescription Diets. And the newest thing that they have, and you're going to be hearing more about this on PetSylvania and throughout the pet world, is their new diet called Metabolic Diet. It completely changes how you put your overweight dog or cat on a diet, doing it safely without dramatic calorie restriction, because it's there's new findings both on the human side and on the animal side about how fat that it doesn't want to go away. And personally, I can tell you I've got some of that just I haven't been able to get rid of, and no matter how much I talk to it about wanting it to be gone, it just doesn't seem to go anywhere. And then of course Sylvania Vet, my business, we are considered a 24/7 pet care destination, which pretty much, if you have anything that you need for your pet, call us first at 885-4421, see if we can meet that need. In almost every case we can. But one of the things is that we're really proud of is that we consider ourselves your pet's healthcare advocate. When we take care of a pet, we're looking at it as to what's best for the pet and what can we do to help that. For us, the importance of overnight care, an animal in our care is never alone, cannot be emphasized. Anybody that leaves their animal at a veterinary hospital and there's nobody there overnight, or they're just stopping in for a quick walkthrough before they go to bed, those animals are sitting in the dark unsupervised. They might as well be at your house so you can watch them the whole time. Recently, this week actually, there was a pretty long article in The Blade about blocked cats and cats with urinary disease. And overall, I thought that the writer did a really good job, but I do think that they left out and didn't put enough emphasis on a significant part of it. The gist of the article is that the most important part about managing a pet's urinary tract disease is to control the diet and use a primarily canned food diet to increase water consumption, and then to watch the mineral content of the diets. And that's all very important. But a lot of times cats develop problems with their bladder. It has nothing to do with the diet, and it may or may not have anything to do with the urine concentration. And we do know that most cats don't drink enough water. In medical jargon, most adult healthy cats have a urine-specific gravity of greater than 1050, and it really should be around 1030. And those are geometric progressions, so that's 200% more concentrated than it should be in an ideal situation. So I certainly encourage you to get your cat to drink more water. One of the main culprits in the development of urinary tract disease in cats is the fact that stress leads to them developing a non-infectious. Very few cats, particularly those cats with specific gravities of 1050 or greater, have a bladder infection. They may have signs that we associate with that: straining to go, urgency, blood, small volumes. Those would all make us think that we have an infection, and it would be true if it was a dog or if it was a person. infection is just almost never the case in cats. And this is an area where I think the Blade really let down. They didn't complete that article with this information. And so the key really is to understand that the disease that causes the straining in the blood and the frequency and all those things in a cat, if it's not infection, what is it? Well, it's what we call feline interstitial cystitis, or previously it was called feline lower urinary tract disease, and before that it was called FUS, feline urological syndrome, and it's probably had other names over the years because nobody's been able to figure out why this occurs. Well, the reality is that they're starting to find out why it occurs, and it has to do with stress. And I saw a cat last night that was showing every sign associated with feline lower urinary tract disease, and lab work supported that there was no infection. And so we're managing this feline interstitial cystitis by dealing with the stressors, and we figured out that the stress that was causing this cat to not only pee out of the box but also poo out of the box was the fact that this is kind of a very shy cat, and there's a couple of new stray cats wandering around outside, and that's the only change that could be causing this cat to be stressed out. So we did a number of things in modifying the things, try to cut down on the frequency of it looking out the window and getting stressed out. We put it on some mood-altering medication called amitriptyline, so that the reality is we're hoping that will solve the problem. At the same time, we wanted to make sure it wasn't a litter problem, and so we added a second box and we changed a litter, and so we've got two different kinds of litter and two boxes now, and we're hoping that this sort of shotgun approach to the solution of the problem is there. Don't think that if you just go put your animal on a canned food diet that it couldn't develop these lower urinary tract signs, and those lower urinary tract signs can lead to obstruction as well. I had a client in that wanted to know how old was her dog in human years. She says, I had heard 7 human years for every dog year. And so that's the old story that used to go on. But when you start stretching that out in a 15-year-old dog or something like that, they're getting to be pretty darn old in human years. And so the newer thinking is that in a dog, the first 2 years is equivalent to 21 human years. And then for each year after that, you figure 4. And so her dog, which is a Sheltie and is 11 in dog years, in chronological years, in real years, if you will, it's actually 57. So from my perspective, I don't think that that's a particularly old cat or dog for that matter either. A question gets asked all the time: are there specialties in veterinary medicine? And the answer is yes. I mean, we specialize a little bit at Sylvania Vet in that we do just house pets, and we don't do farm animals, and we don't do horses. And yet within our profession, there are true specialties. There are orthopedic surgeons, and there are ophthalmologists, and there's neurologists and dermatologists and cardiologists and internal medicine specialists and cancer specialists and soft tissue and heart surgery specialists and radiology specialists. And they've got their undergraduate degree, they've got their veterinary degree, and now they've got 3 to 5 years of a internship residency before they're ready to go out and start practicing their trade. So those skills are really valuable when we get involved in a lot of complicated cases. And so we're very attuned to when we think a case is going beyond our capability, we're able to send them to specialists. There are none in Toledo. If your dog needs a specialized surgery, it needs to travel either to Columbus or East Lansing or up to Southfield, Michigan or Oakland, Michigan. Those are the closest specialty practices where the people that are called board certified practice their brand of medicine. So we're going to take a break, and we'll be back in a couple. Well, we're back from break, and certainly want to encourage you to support the sponsors on WSYL, and that keeps us on the air, and I think that's all good. I got a couple of questions from Colleen, and I really love it when we get some questions. That means I don't have to invent all the topics, and so I really appreciate Colleen, and she makes the nice comment that she likes listening to us, and that's even better, of course. And so tell your friends about PetSylvania. The first question that Colleen has is, what's the life of a tick? If they remain on your pet, how long can the tick live? How long would it be before my pet would show signs of illness? There's multiple questions there, and the reality is that a tick will live on on the animal while it's engorging itself. Ticks are bloodsuckers, and so they jump on there and they crawl on there. They come off the bush and they get on there and they burrow down, and then they attach with really strong jaws, and then they start sucking blood and they get bigger and bigger. And so when you start with a tick that's just gotten on, and if it's a brown dog tick, because different kinds of ticks will have different sizes at beginning and end, but they may be not much bigger than a BB when they get started, looking like a little round, flat object. And when they're full grown, they may be bigger than a nickel, and their body will look gray as it's filled with blood. Now the scary part is that's not their mission in life. Their mission in life is to live and lay eggs so that there can be more ticks. So what do? They drop off. If they get off and drop off in your house and you get ticks in your house, you've got a real challenge on your hands. And so you got to be careful of that. So how long can a tick live after it's been engorged? I don't know the answer to that question. I'll have to look that one up and see what I can find out. And tick transmission in the transmission of disease is generally probably going to be several weeks to even several months before a tick-transmitted disease like Lyme disease or Rocky Mountain spotted fever, or Ehrlichia, Anaplasma, any of those could be cause clinical disease or at least be detected. Now, just a couple of thoughts here. We use a blood test that tests for not only heartworm, but Ehrlichia, Rocky Mountain spotted fever, and Anaplasma. So we're checking on a regular annual basis in the dogs for exposure to those tick-transmitted diseases. And then the way we recommend controlling ticks is either using Frontline Plus as a topical, or we think the best thing now is a thing called the Scalibor collar, because it repels ticks, kills ticks, repels mosquitoes, and actually provides a little bit of killing technique on fleas as well. The next question that Colleen had for me is, are there worries about exposure? Because the neighbor puts decon rat poison in their pole barn, and then the kids and the dogs are in that pole barn playing on the straw and with the animals and everything. And is there any danger? And the answer is truly yes. The dogs may very well want to eat that decon, and depending on the age of the children, they too might be a bit curious. And there was actually something I read here recently where the government's talking about outlawing these products because there's about 10,000 exposures per year of children to the decon poisons, and that a small percentage of those 10,000 end up having to be treated. But the worry I would have with that, and I think it's short-sighted, not that the government ever does anything that's short-sighted, but that is that if they eliminate what is a very effective and very safe and very humane way of dealing with mice and rats, what kind of diseases are going to get transmitted and what kinds of worries are we going to have in communities? The city of Toledo actually has a rat patrol, and they go around and they bait areas where there's been a lot of rat sightings and vacant lots and places like that. So I certainly don't think that outlawing decon would be a good idea. And decon poisoning can be treated, and so that's important. So when you talk about toxicities, we had a dog in, again, we've talked about this before, but it got into orbit gum, and got xylitol toxicity. And xylitol toxicity is really, it doesn't take much xylitol to be very toxic to a dog. And I actually, one of my employees actually has a former employee at another veterinary hospital in Cedar Rapids, Iowa, that her dog was talented enough to get into a purse and get the gum out of the purse. And this dog got treated for xylitol poisoning because it wasn't secure. And I had a dog once that the chewed gum had been put on the bedpost. So don't leave your chewing gum on the bedpost overnight. Famous song from my youth. This dog got into that, got enough xylitol, and became toxic from the xylitol toxicity. So we certainly have a couple issues there. One is the toxicity of xylitol, and then we better be talking about hygiene and where you put your used gum, because I don't think the bedpost is where any of us would like to see it. The importance of spaying your dog cannot be overemphasized. We had a case in this week, and the good news is that most people realize that they should spay their dog. But there's a good many that, for reasons of their own, they've wanted to breed them, and then they were done, but they decided not to get her spayed or whatever. But I had a dog in with developed pyometra, and pyometra is an infection-like process in the uterus that comes on after a heat cycle. And dogs never go through a menopause, so they will have heat cycles no matter how old they get. And this dog was clinically very ill and had a really difficult time recovering from the toxicity that the pyometra occurred. So please, please, please get your dog spayed. It's in the best interest. We certainly don't need any extra puppies out there. For that matter, we don't need any extra kittens out there, so get your cat spayed as well. You're doing it to not only birth control, but to head off conditions like pyometra, to head off conditions like mammary cancer. We had a mammary cancer case that came back this week that we took a growth off in a cat, and those are very bad. That's really a big concern. Wanted to spend a little time talking about canine infectious influenza. It's flu season for us, and so we're very tuned into it. And we all are encouraged to get our flu shots. In the dog, there's a flu virus, and that flu virus is not seasonal like ours is. We're truly fortunate that the Northwest Ohio area has yet to have an outbreak of canine influenza. Prevention is the key. Should we have a break of canine influenza in Northwest Ohio, it will be too late to get your pet vaccinated because it takes a month to establish immunity, and by then there will be a tremendous amount of truly ill animals, a percentage of which will die. Another larger percentage will have permanent damage to their lungs that will affect their health throughout the remainder of their life. Vaccines, there are two companies that make vaccines. They're both highly effective. If they don't prevent the disease, and that flu vaccine is never considered 100%, they lessen the severity of the disease. They lessen the likelihood of those permanent lung changes and the damage that's done there. They shed the virus for less, so hence they become less contagious. So overall, it's much, much better if we go ahead and prevent that. So I encourage you to get, if your dog has not received a vaccine for canine influenza virus, I strongly encourage you to call and schedule that appointment right away. I'm going to touch really quickly as we wind up this session on weight loss. And so the traditional way to lose weight is to decrease the calories. Dogs should get on a diet, should get about 15 calories per pound per day for the ideal weight. Decrease the treats, I always say, by at least by half, both in number and in size. Decrease table food to zero, all right, and then increase exercise. But what happens when that fails? And that's where this new diet from Hills called Metabolic Diet enters the picture. As we learn more and more about that, and that hits the market in the next 2 to 4 weeks, we're going to talk more about it, and I think we're going to see some dramatic changes in the ability of dogs and cats to lose weight when we start getting them on Hills prescription diet, Metabolic Diet. It's time to take a break, and we'll be back. Well, we're back to wrap things up, and so the first thing that I want to do is give some great props to Dr. Andrew and Crystal, because earlier this week they put on a terrific cat-friendly seminar for the public, and it was free, and we had nice attendance. Everybody got a door prize, so we're going to do another one, but they really deserve a big hoorah for what they did, and my hospital manager Terry also participated and did a great job getting things organized. I have such a great staff. I'm so blessed to have such great people working for us, and that are not only concerned about the health and welfare of your pet, but educate the public about important issues. With that said, we have an adopt-a-thon in about a month, and then in the month of April, we're going to do our next seminar. The date is yet to be selected, but the subject is going to be how to select a diet for your pet, how to read a label, and fact or fiction about what is considered common knowledge out there on the internet. We're going to talk about those fact and fiction issues. And then we're going to spend some time talking about metabolic diet, because it is truly a game changer when it comes to dieting an animal and keeping them healthy. And keeping a dog's weight under control, a cat's weight under control, cannot be emphasized. Elanco, thank you for the sponsorship. They have Trifexis and Comfortis, and they have a deal going on right now that's going to go on indefinitely. But if you buy 12 Trifexis or Comfortis, you're going to get a $25 rebate from Elanco. And if you buy 6, you're going to receive a $10 rebate. And we have great prices on those products. I challenge you probably to look and see if you can find a better price on those products. They do require a client-patient-doctor relationship to be able to be sold to you. So you have to be a client in order to be able to buy those. I want you to listen to K100. We've started to advertise on there. I'd love to hear what you think about our advertisements, because I think they're pretty fun, and they talk about the importance of our 24/7 presence in an emergency service. Within the next month, there's long-anticipated participation in TV13's Get Connected. We're almost finalized on that. Thank you, Esplin Medical, the premium environmentally friendly surgical scrubs. They are naturally stain-resistant, naturally antimicrobial, great product. Very comfortable. You've never worn anything like them. EsplinMedical.com. Again, Hills, thank you. Makers of Science Diet and Prescription Diet, one of the 4 super premium dog foods that we recommend. And of course, Sylvania Vet, 24/7, 365 staffing with a technician and an assistant in the building, and a doctor always on call and available for emergencies. We are your pet's healthcare advocate. Call us anytime, 419-885-4421. We will answer the phone. You can look up and learn more about us on the web, www.sylvaniavet.com. Patient care is our mission. Customer service is our passion. And with that said, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.